Good morning. I'd like to welcome you all with Coffee with the Sheriff. This morning, my special guest is Dr. Iulia Vann.
Hi, good morning. Thank you so much for having me here today. My name is Dr. Iulia Vann. I'm the Guilford County Interim Public Health Director. Thank you for having me.
Well, we thank you very much for the opportunity to give us a chance to talk with you, to learn more about COVID-19, as well as what's going on within our Guilford County community.
Absolutely.
Okay. Of course, the last 3 weeks has been challenging.
Very.
For not just the Sheriff's Office, but for the citizens of Guilford County, as well as the medical teams in Guilford County.
Yes.
So one of the things I like to speak with you about or ask the questions about is what can we do as a team, the Guilford County Sheriff's Office, what can we do to continue to help or to continue to educate our citizens in Guilford County based off of what you've seen that's going on throughout Guilford County?
Sure, and thank you again for the opportunity to be here to share some of the experiences that we've had so far, some of the education pieces, and some of the some ways that we can all partner to make sure that our communities are safe. You're absolutely right in saying that the last few weeks have been very challenging for everybody. We know that it's very hard for our community. I know that it's very hard for our critical personnel, our healthcare personnel, law enforcement, first responders, and we just want to make sure that we're keeping everybody safe and that we're keeping everybody educated. I think that one of the main things that we need to keep in mind is that education is a critical piece in the response to COVID-19 and making sure that we are stopping the spread of this disease and that we're stopping the spread of this virus in our community, in Guilford County, in North Carolina, and then all across the nation. Your team as law enforcement, I think, are critical to this. We need to make sure that we let everybody know that staying at home and practicing that social or physical distancing is a critical part in stopping the spread. So making sure that everybody understands this is one of the most important pieces that we need to focus on. Why are we saying that this is important? Well, we know that the virus is being spread person to person. We know that staying within 6 feet of a person, within 6 feet of groups of people is efficient in making sure that you're not catching the virus. We also know that the virus is being spread even before somebody starts exhibiting symptoms. So if somebody is feeling well, they don't have any symptoms, they feel like they're normal selves and they're going around their business, not practicing this social distancing, physical distancing, they're continuing to spread the virus. So that is putting our entire community at risk. I know that your team is responding around the clock to different calls, to different events, and we just want to make sure that our community understands the importance of staying home. Our stay-at-home order is in place for a reason, and our stay-at-home order is there to protect everybody. We do not want to keep people at home and out of school and out of their businesses for no reason. We want to make sure that our healthcare system is not overwhelmed, that we're saving lives, that we're protecting the ones that are at risk, the ones that are over 65, underlying conditions, and just making sure that all of the high risk, the entire high risk population is safe. So that starts with us. It starts with our community, and it's important to be mindful of that. Okay.
Well, and you made some good points there. The last couple weekends, I noticed that our patrol units have answered more calls regarding disturbances because people have been enclosed in at home. That breeds, unfortunately, domestic calls, domestic disputes. We've seen calls where we've had to go and answer about people calling in regarding mass gatherings. what we've done the last couple of weeks is continue to have empathy. We want to make sure that we have some sense of understanding because it affects all of us.
Sure.
So when we get a chance to speak with the individuals, we try to make sure that they are aware of the danger of not surviving this virus.
Yes.
So because we don't know who's hosting the virus. I've seen over the last couple of days how the fatalities continue to increase. Here in the state of North Carolina, unfortunately, Guilford County being one of the largest counties is one of the largest counties that's been noticed about the virus, with the people have attracted the virus, or better yet, we've lost individuals. I think this morning it was like 114, I think it was, in Guilford County, if I'm not mistaken, around about those numbers, and I think we've lost 6 individuals within the last several days. And we've seen how it has impacted the county. So what we're trying to do is to continue to educate, but yet as we're educating, we continue to be educated, because every day, as you and I were speaking earlier, every day something changes.
Yes.
I mean, something may change 2 or 3 times before the day is out, or within the hour or two, and you think, oh, we thought we knew this, and it was something else. So our goal, or my goal as the sheriff, as the sheriff of Guilford County, is to ensure that the men and women who works with us within our detention centers, our office specialists, our patrol units, our special operations, and everybody understands that we're here to educate them how to deal with the public as we're dealing with this crisis at this present time. One of the things that we put in place, and I'm very grateful that you all was able to get the information out to us, was to protect our inmates or our residents. I like to call them residents because there's the population of people that are there, and we've had to change visitation.
Yes.
We've had to change volunteers from coming in. When you come into the facility, temperatures have been checked, from staff to the chaplains to attorneys or whoever, vendors that come in.
Sure.
So we've had to do that. Even those that are being incarcerated for the first time during this crisis, we've even had to put them in a different floor, because we don't want to bring the outside in and put them in the general population that we have, to try to make sure that we can eliminate the spread of the virus. And keeping the facilities clean, oh God, that is a big plus. And honestly, it's been really great, good. Not use the word great, but good, because the residents as well as our staff and all have done pretty good, really good.
That's
and
wonderful.
Maintaining cleanliness, making sure
Great.
that we can maintain, keep the virus down as much as we can. We've had some scares, we have. Had one that was sent home because of the flu. We thank God that was the flu. We've had some deputies that have had to be self-quarantined because of interactions with people.
Sure.
But once again, it's been good. EMS, Metro 911, when they give us a call, they let us know whether or not an individual has been tested or have the symptoms. So that gives us the opportunity to make sure that our field units are secured with protected, whether with masks, the gloves, the hand sanitizer they have in the vehicles, as well as the cleaning solution to keep the vehicles wiped down.
Excellent.
So we're doing things, but you wonder at times, is that enough? And unfortunately, I don't believe that it is. I think what's going to happen is that the people have to realize that we need their help and their support.
Absolutely, yes.
So lead us into, if you can lead me into a way that you believe that we can better interact with the community, either through, of course, we have to respond to calls,
Yes.
But maybe through PSAs or which is public service announcements, or some other ways you may think that will be productive in helping us. What suggestions do you have?
Sure. So first, let me go back to a couple of the things that you've mentioned. Yes, I think that people start hearing the fact that this is a rapidly evolving situation, and they tend to hear that and forget that everything changes so fast. Our guidance is changing from week to week. Our way of approaching this is changing based on the new evidence that's coming out. So we're constantly trying to keep up with the newest information and the newest guidance. Also, the things that you have put in place in your facilities are definitely best practices, and I think that putting all of those things in place are keeping that particular community safe. So I think that that's excellent. Also, I want to mention the fact that the numbers are growing in Guilford County and across the state. We're seeing changes in the way that the testing is being done, so the criteria becomes more and more restrictive because of the supplies are in, we don't have the necessary supplies to perform the test for everybody, so that is maybe skewing the numbers a little bit when it comes to the positive and the number of cases. But my point is that I would like for our community to look at those numbers and not just see numbers, but actually see people, that those people that have lost their lives in Guilford County, those people that are positive right now, they can be their parents, their children, their family members, their friends, and try to understand that this can impact everybody, and try to think of that, and with that in mind, to practice the guidelines and the recommendations that are being put out there. So trying to put faces to some of these numbers to understand the true impact, I think would be very important for our community to really understand that. Some of the suggestions that would probably bring some benefit to our community when it comes to your team and addressing these issues, I think, is to truly do an educational response. We do not want to use our stay-at-home order and our emergency situation to incarcerate people or to bring some type of negative actions to them, but we want to empower them, we want to educate them so they can make the right decisions. I think that everybody needs to respect the role that law enforcement is bringing to the community right now. Social media is one of the biggest and most important pieces that we think are at our disposal to share information. Using the PSAs like you've mentioned, I think that it's also important. Having that constant communication with our news outlets, it's also very important. But if we're sharing information on social media, if we are using this platform right now to educate our community, a lot of our younger folks are using this to educate their families as well. So I think that we need to continue to do that. You having this way of addressing the community, I think it's extremely beneficial. So using this platform to share the message, to share the importance of social distancing, the message of avoiding crowded spaces, trying to stay home as much as possible, and not with your entire family that you've invited over, but with your immediate family that you normally live with, and making sure that everybody is staying home when they're sick, searching and looking for medical care if they're ill. All of these can be shared in certain platforms that everybody has access to. So I think that that would be a very good strategy to for your office and for your law enforcement team members to use. And when they're going out in the community to have the information for different members, and when they're hearing some myths or some information that might not be 100% accurate, to be able to give them the right information.
Right. Well, you know, it's interesting because the past several months, I began to change up on some of the vitamins that I take, some of the smoothies that I take in. And it's interesting, I understand that vitamin A, B, C, D are some of the strongest vitamins that will help us fight off some of this stuff, you know, boosting our immune systems. How important is that to make sure that our immune systems is boosted, as well as resting when it comes to trying to fight off not just COVID-19, but the flu, the regular cold things that people may face? How important is that?
Well, I think that it's important for all of us to try to maintain a healthy body, making sure that we get enough rest, do enough sleep, that we hydrate ourselves, that we keep our immune system up as much as possible. So in the response to everything, I think that that would be something that we need to keep in mind, making sure that we're eating nutritious meals, that we're keeping up with our exercise, that we're keeping up with our fruit and veggie intake. I think that all of these pieces continue to be very important in our body's ability to fight different things that are coming our way. So absolutely, I'm definitely letting everybody know that they need to continue those healthy habits. And if they don't have healthy habits right now, then maybe this is the time to start on cutting down on some of the bad stuff and bringing in some good veggies and some fruit. And replace the chocolate with maybe an apple.
I like that chocolate too. Well, you know, the last 3 to 4 days, maybe I go back as far as saying maybe 5 days, I've noticed how the media has began to shine more light on the African American community, on the Latino community. And based on the fact of sharing the light, it has shown that we are, or those two particular groups are the ones that are suffering the most, a lot of times because of the lack of insurance, the poverty communities that they live in, the lack of not being educated. So as we begin to wrap up, what can we do as a sheriff's office to help Guilford County Health Department do what you all are doing to get the word out to try to help out with those communities?
Absolutely. So I think that it's definitely something that has been a focus in the last few days. Us as public health professionals, we have been looking at these health disparities for a very long time now. And it's not just happening now with COVID-19, it's been happening with a lot of other things. And that's when we start talking about, oh, our heroes are going out to respond. Wonderful. And the conversation around social determinants of health. And I think that now the conversation starts happening around COVID-19, but we know that housing, transportation, income, education, and all of the other nutrition, all of these factors have some type of repercussions when it comes to someone's health. So we know that for a long time that our Black and brown friends are more impacted by so many other different things. So we need to continue that work as a community from a health care, from a public health, from an economic standpoint, to make sure that all of our communities have the resources that they need to be successful, to be healthy, to make sure that they're taken care of. So I think that sharing this message with the community, empowering them, giving them the education that they need, helping them understand that it is important for them to follow the guidance, that it's important for them to understand that listening to the right message is the right thing to do, would be a tremendous impact to our entire community that your team can work on to be an extension of public health within that specific community.
Well, Dr. Vann, I thank you very much for taking the time out to stop by today to speak with us and to educate us.
My pleasure. Thank you for having me.
Yes, ma'am. I'd like to take this time to say COVID-19, it does not discriminate. It does not matter whether you black, brown, white, any race, does not discriminate. Does not discriminate whether you're rich, wealthy, poor, or in between. It does not discriminate whether you live in the hood, whether you live in the wealthy community, or whether you live in the rural sections of the county or the inner city. It does not discriminate whether you like me or not. But we are all in this together. Makes no difference. We must work this thing out together. I'm asking you all here in Guilford County and throughout the state of North Carolina and throughout the globe, focus on the fact of what you can do or what we can do as individuals to help save a life. Our goal is to bring pro-life, be longevity, make sure people are able to have a better health quality of life. My name is Sheriff Danny H. Rogers with Guilford County, and I thank you all very much for your time, for watching, and for listening. And I also want to take this last minute and say I thank Team Guilford, which is the Guilford County Sheriff's Office, every employee, for your hard work and dedication that you have given back to the citizens of Guilford County. Thank you.